Everyone, this is Dr. Prasanna. Today I would like to cover the basic dental anatomy. In this, we will discuss about how the formation of dentition occur, nomenclature, tooth numbering systems and parts of a tooth, line angles and point angles. These are the topics covered. So first one is the formation of dentition. How the tooth is formed. Tooth we usually know we have two sets of dentition, primary and permanent. In the primary dentition, which is also known as deciduous dentition, usually begins to form prenatally, which means before birth, in the embryo, and means in the uterus, at about 14th week, which means at the tooth formation starts at about 14th week, and it will complete formation of primary dentition occurs at 3 years of age. Usually 14th week we can able to appreciate the formation of tooth buds, and it progresses into a complete tooth form. We can able to appreciate complete set of primary dentition in a 3 years child. So it usually starts at 14th week and you complete postnatally after birth at 3 years of age. So if there is no any abnormalities when the child is in complete healthy condition, the tooth usually erupts into the oral cavity at about 6th month of age. In 6th month we usually appreciate mandibular incisors to erupt into our oral cavity. Most commonly usually incisors erupt, which is at a 6th month of age. And the primary dentition period stays up to 6 years. After this, at the 6 years we usually appreciate the appearance of mandibular molars. This mandibular molars appears after at 6 years of age. This appearance of mandibular molar or any molar leads to formation of emergence of this tooth leads to the formation of mixed dentition or transition period. In mixed dentition period, what exactly happens is, in this we can appreciate eruption of mandibular molars or eruption of molars, and shedding of the primary incisors, and eruption of eruption of man eruption of incisors, permanent incisors occur. So in the mixed transition period we can able to appreciate appearance of molars and eruption of permanent incisors. So during this period, if it usually lasts for 6 to 12 years, during this period we can able to appreciate permanent incisors and permanent molars, whereas the deciduous canines and deciduous molars are usually in the oral cavity. When the child progresses, the deciduous tooth shed off and form and leads to the eruption of permanent canine and permanent premolars. So it usually completes at 13 years. So permanent dentition complete permanent dentition starts from 13 to 14 years of age. So this is basically the how the tooth usually formed, and how it progress, and how the teeth continued until normally we have third molars also, which usually erupts at 18 to 22 years of age. So complete permanent dentition completes usually at 18 to 22, but basically after 24 25 also third molar erupts. And next comes to the nomenclature. I'll add so less words because it's a basic, no. We usually call upper jaw as a maxilla and lower jaw as a mandible, and whereas the primary tooth are also known as deciduous tooth. Permanent sometimes we can call as succedaneous tooth, and we can come to know the more number of nomenclature on going through. And next comes to the formula of million tooth, which is nothing but we can able to appreciate we can able to appreciate the teeth which are present in humans are different from another animal. So by using this formula we can know what type of teeth are present in humans and what type of tooth present in animals. So to differentiate that, we usually have formulae. So what are the formulae for primary tooth? Primary usually have 20 set and each arch contain 5 tooth, and one side of the arch, I mean complete one side, contain 10 tooth. So here I represent incisors, C represent canines, P represent premolars, and M represent molars. Premolars are usually absent in case of deciduous dentition. After the deciduous dentition, in permanent dentition, premolars are usually present. So in the formulae of primary dentition, we can't appreciate P because premolars are absent. Here, how we read is incisors, 2 maxillar and 2 mandibular, canines, 1 maxillar and 1 mandibular, and molars, 2 maxillar and 2 mandibular. And the total one side contain 10 tooth, and each two sides leads to 20 tooth. So 20 tooth. So this is the dental formula for primary dentition. When it comes to dental formula for permanent dentition, we also have premolars and we also have another molar, which means third molar. So in this formula we can able to appreciate P as well as molars 3 by 3, which means molar 3 maxillary and 3 mandibular. So it contain total of 16 plus 16 leads to 32 number of teeth usually present in permanent dentition. I think you got the formulas, and we should remember these things and we should read according to what they are called. And next comes to tooth numbering systems. Tooth numbering systems, we have so many tooth numberings, but basically what we know is three: universal system of notation, Zsigmondy and Palmer notation, FDI, which means Federation Dentaire Internationale notation system. These three notation systems are commonly used. First one is the universal system of notation. It is very simple. Each tooth have a specific identical number and very easy to write but difficult to remember. So even though it's usually numbering starts from right maxillary last molar. So this universal numbering system, it usually starts from right maxillary, which means from the last molar, and from last molar to the incisors it is represented from A to E. From incisor to left second molar, second deciduous molar, we give F to J. So A to J represent the upper arch, whereas K to T in reverse they represent mandibular teeth. So even though it is easy to write because we can able to write from A, B, C, D, E, because each arch contain 5 tooth, F, G, H, I, J, and from here we write in reverse manner: K, L, M, N, O, P, Q, R, S, T. This is very simple to write, but to remember what tooth have what name, so we usually don't use this. So permanent tooth also having the same thing, each tooth having a specific number, but here we use numbers rather than letters. It also starts from the third molars, right third molar, 1 to 8, here 1 to 8, and 8, 9, 10, 11, 12, 13, 14, 15, 16. So here up to 16 represent the upper arch. Here also we write in reverse manner, 7 to 24 and 25 to 32. even though it is easy to write, it is difficult to remember, so commonly we don't use. And in the Zsigmondy and Palmer notation, each quadrant here, each quadrant represent what its side, and also each quadrant having the same number, tooth having the same name, but we can able to differentiate by using symbols like quadrants. 6 which represent usually, this will be the right and this will be the left, right? So if you write this, this means left maxillary molar. So it is very easy to understand and very easy to write, very easy to remember also, but it is very difficult to communicate. Here every tooth having a same number, which for deciduous A B C D E, A B C D E, but each having same name. I mean, centrals having A, laterals having B, canines having C, first molar, every tooth having the same name, but the quadrant gives the idea of what tooth we are talking about. So it is very easy to remember but difficult to communicate between the dentist. So here each quadrant represent the side, which means right maxillary, left maxillary, left mandibular, right mandibular. Here also the same, so for primary dentition we call it from A to E. For permanent dentition, each tooth represent by number, and here it is called 1 to 8. 1 represent maxillary incisors and 8 represent usually molar, third molar. So this is the Zsigmondy and Palmer notation, commonly used but difficult to communicate. So the FDA, Federation Dental International, produce a notation which is very easy to remember, because we can see in the deciduous, in the FDA notation system, each we can same numbering system, but each quadrant, here we don't use any type of symbols, but here each quadrant gives a number. So for deciduous teeth, the maxillary right given 5 and maxillary left given 6, mandibular left given 7 and mandibular right given 8. So 5 to 8 represent quadrants, whereas 1 to 5 represent teeth number. 1 represent incisors, 2 represent lateral, same. But here first number, two digit system, this is also known as two digit system. First digit, two digit system, first digit indicates, I mean if you think it's 51, first digit indicates quadrant and second digit indicates tooth number. So 5 to 8 represent deciduous, 1 to 4 represent permanent. So 5-1 means maxillary right incisor, 6-1 means maxillary left incisor, 7-5 means mandibular left second deciduous molar. So it is very easy to communicate, so easy to understand and easy to remember. So 5 indicates maxillary, so we should remember 5 to 8 represent deciduous, 1 to 4. Here in the in permanent dentition, here also 1 represent maxillary right, 2 represent maxillary left, 3 represent mandibular left and 4 represent mandibular right. So this first number indicates quadrant and the remaining 8 each tooth having each number, and it is very fixed. So we don't each tooth also having a specific number. There is no change in, we don't able to confuse also. So each number also each tooth also have a different number, so very easy to understand. I hope you understand the tooth numbering system. Very easy to write and very easy to communicate, and we all should know the tooth numbering system, because as a dentist we know what the patient is saying. Even though the patient don't say the number, when we discuss among ourselves in between the dentist, we don't say the maxillary, right, left, like that. We'll just say 3646 3545, that's it. So you should remember each and every tooth what is the number of that tooth. So next comes to parts. What are the parts of a tooth? I'll go through basics. This will be the crown, and this will be the root, and this will be the apex part, which is away from the occlusal. This is occlusal part, or as it is an incisor, it is an incisal part or incisal edge. So this will be the labial surface, and the face which is towards the tongue, usually like this, having a cingulum. Sorry, I'll usually like this అనుకోండి. This will be the lingual. Hope you and this is a CEJ, which is also known as cervical line, and this is the root part. These are the basic teeth for anteriors. When it comes to posterior teeth, we'll usually have a bifurcation or trifurcation roots for the molars, and these are the cuspal edges. So we have cusps, and here deep depressions are fossas. This will be the inside, we have a pulp chamber, and this will be the chamber, and this will be the pulp canals, and this is a bifurcation roots and with apex. So usually the tooth root is covered by cementum. This is covered by cementum. Through the cementum and periodontal fibers, it attached to the bone. So this is the lingual part, as we discussed earlier. This is the lingual part, and this is the labial part. This will be the lingual part, and the proximal parts usually are called mesial and distal. If you think this line as a midline, the one which is the side which is close to the medial line, which is medial surface, mid sagittal line, is known as medial surface. The one which is away from the midline is called distal surface. These are together called as proximal surfaces. These are the surfaces of a tooth. For anteriors, we'll have labial, and opposite side of lingual, mesial, and distal. Usually having and this will be the incisal surface also. Usually 4 surfaces. For posterior teeth, we extra having the occlusal surface, including these 3. Usually the posterior teeth having cusps, whereas the anterior tooth usually doesn't have any cusp. So we'll have incisal areas. Here we'll have occlusal surfaces, and this is a gingival tissue. And next comes to the this is the lingual side part. We have a cingulum, which is a prominence part, and we have also cervical line here. The fossa, which is known as lingual fossa, usually here the tongue usually rests. If there is no proper occlusion, will leads to formation of open bite also, like this. So usually mammalians are present. These are the mammalians, means this depressions or mammalians. So we'll have, these are the marginal ridges, incisal ridge. This will be the cingulum. This will be the fossa. It is a basic parts of a tooth on lingual surface. So this is a medial line which is close to the surface, or medial surface which is away from the surface, or distal surfaces. So towards the medial line, mesial means away from the medial line, distal surface. The surfaces which is facing the lip, which means labium, or labial surfaces, which is facing the buccal surface, which is facing the cheek, are known as buccal surfaces. All together constitute called as facial surfaces. We usually maxillary, as it is the posterior parts, which means the lingual surfaces are close to the palate, they are called palatal surfaces also. And next goes to what are the line angles and what are the point angles. Line angles and point angles, we don't contain actual line angles and point angles in a tooth, because they undergo wear during progression of time. So these are the purpose of this is to indicate the locations. So firstly, the tooth, usually the tooth divided into the first complete tooth is divided into crown and root. This crown part, I'll again with diagram. This complete tooth is divided into crown and root. So this crown is again divided into 3 parts, which means this helps to know that towards the this will be the mesial, distal and middle. And this tooth again divided into three quadrants, which means cervical, middle and apical. And this crown is also divided into 3, which means incisal, middle and cervical. So after dividing the tooth into crown and root, and crown again into three parts, we also divide the tooth lingual surface like labial surface, lingual surface, middle surface, and posterior teeth also divided into buccal, middle, lingual. So these are all are divided to indicate line angles and point angles. Usually anterior tooth have 6 line angles and 4 point angles. I'll show in diagrams, whereas posterior tooth having 8 line angles and 4 point angles. Line angle is nothing but interaction of 2 points are known as line angle, whereas interaction of 3 points called as point angles. So it is what means a line angle is formed by the junction of 2 surfaces, whereas point angle is formed by the junction of 3 surfaces. So I'll show in the diagram. If you think this will be the labial surface, lingual surface, labial surface, lingual surface, mesial surface and distal surface. In the labial surface, if you think this will be the labial surface, and this is the incisal surface. So labio incisal angle, this angle is known as labio incisal angle. So if you think this is a lingual surface. So in this lingual surface, this is the incisal angle, and this is the incisal angle, and this is the lingual angle. So this is known as linguo-incisal angle. And again comes to this will be the distal surface. I'll write. This is the distal surface. So in the distal surface, if you think this is the distal side and this is the lingual side, so this interaction is known as disto-incisal angle. Whereas this is the labial surface and this will be the distal surface. The interaction of these two surfaces is known as labio distolabial. This is the labial surface, this is the distal surface, and this interaction of these two is called distolabial surface. And if you think this is called mesiolabial angle, and this one is known as distolingual line angle. So interaction of two lines are result in the formation of line angles. When it comes to point angles, we usually have 4 point angles. Interaction of 3 surfaces we usually show, so we always contain 4 point angles. So for posterior teeth we have 8 point angles. For anterior tooth, you'll see this is the point angle. So this is a point angle. If you think this is a labial surface, it consists labium, incisal, as well as if you think this is a mesial surface, so we have mesiolabial incisal point angle, mesiolabio incisal point angle, and this will be called as mesiolingual incisal point angle. So this will be the mesioincisal point angle, and this will be the mesiolabio incisal point angle. When it comes to this side, this will be the distolabio incisal point angle, and this is called distolinguo incisal point angle. So these are the point angles for anterior tooth. When it comes to the line angles of posterior teeth, it is a junction of two surfaces, which means if you think this as a labial surface, labial means buccal surface, we have bucco-occlusal line angle, mesiobuccal line angle, and also this will be the distal side, right? Distobuccal line angle. This will be the bucco-occlusal, mesiobuccal and distobuccal line angles. And I'll draw the lingual side now. This will be the distolingual line angle, mesiolingual line angle, and linguo-occlusal line angle. So here we completed 3, and now I draw the distal surface. So in the distal surface we'll have, we already discussed the distobuccal line angles and mesiobuccal line angles, and extra line angles we have is mesio-occlusal line angle. This will be the mesio-occlusal, and this will be the disto-occlusal line angle. And we also, so these 2 line angles are added, including these line angles. These 2 line angles are added. What are there? Mesio-occlusal line angles and disto-occlusal line angles. I think here not given, but we usually have 8 line angles for posterior teeth. So this will be the disto-occlusal line angles. And what are the point angles for posterior teeth are mesio-occlusolingual. which means mesolinguo-occlusal point angle, and this will be the mesio-occluso-buccal point angle. When comes to this one, distolingual occlusal point angle, whereas this one is called as distobucco-occlusal point angle. So these are the point angles and line angles we should know for construction of the tooth. Like any composite resin restoration, we should maintain these point angles and line angles to form a teeth, and which is usually remember the entire structure of the tooth. Thank you for the video. Hope you like it. If you like it, share the video and subscribe.